Do you want to put an end to your knee pain? Pain that pesters a quarter of all Germans, even more the older they are. We're going to show you a pain osteopressure technique, a version where you press away the pain in the truest sense of the word, something absolutely new here, and an exercise that goes with it. I'm sure you'll be surprised. Let's start with the pain osteopressure technique. For this purpose, we're going to use this cone from our set. In case you don't have our set yet, you can find the relevant information up here. For the time being, just take some household item that has roughly this shape. Round it off like this here, and a bit soft, because we work with bones, and here you should avoid hard on hard. This here is perfect. And Mira, please lie on your back. And let's locate the spot. How do you do that? Mira and I are going to show you. Put your fingers here on the hip bone. Where this bone ends, you'll find a smaller bone called the iliac spine. For those of you who wear jeans, the point is often at the small hip pocket. So if you're lost, put on your jeans, put your finger on the small hip pocket, and there you go. That also goes for the other side, of course. Let's assume that Mira has problems in her right leg, the right knee. So now go to that spot, and as soon as you have found it, this little protruding bone, move your finger 1 or 2 centimeters towards your crotch. Run your finger lightly over that spot. And you'll notice this spot is a bit more sensitive than the area around it. And that's exactly the spot you're looking for. There is a muscle that is immediately associated with pain in your knees, a muscle that is almost always shortened and stressed. Now, you take this cone and, from above, put it carefully on the spot and feel for the most sensitive part. Take your time. Try this at home. Mira's doing the same thing here. Take your time. I think you should move it up a bit more. There it is. If you're lost and having trouble finding this spot, just go to one of our physical therapists and ask him or her to show you and maybe even treat you so you could see how effective this treatment is and then go home and do it yourself. I guess you found it, right? And now you apply pressure, so much that you start feeling some pain, up to a 9, 9.5 on your personal pain scale of 10. Then you wait and breathe calmly and try to relax. And then you will notice that the pain is slowly subsiding because we're taking away the tension. Remember, the more tension we take away, the less sensitive this spot becomes. Stay on it. If you notice it's not enough anymore, change the angle. Play around with it. Increase the pressure. You're in control and can determine what happens with the tensed up muscle in this area. And you do that for 1 or 2 minutes, 3 at the most, and by then the muscle is so relaxed that you could start with your exercise. Slowly ease the pressure and take away the cone so it's not too abrupt for your body. And then we immediately switch to the exercise. Mira, on all fours, please. Your head in this direction. We're going to do that for every situation. Mira, please move a little bit. Perfect. Now, slowly go back a bit, and you'll see the knee angle gets smaller. Stop here, please. Maybe that already means stop for you. Maybe everything is so shortened that you can't get any deeper. If that's the case, do the exercise in this position. But maybe you can go back even more, so that you almost sit. And then you could put a cushion underneath and find the right position from where to start with the exercise until you reach your endpoint. And at some point, you could sit upright like this. I always say, everybody should be able to do this, even if only for a short time, to sit like this for at least 2 minutes. Anyone that cannot do this already has a knee problem without even knowing it. And we take it even further. Slide up a bit, please, so we have more space. And now, put your hands down to your side, but be careful now. Now it's important to pay attention to the following. Do not bend over above the pelvis, but take your pelvis with you. Mira already showed us. If you flex your abdominal muscles, then you lift your pelvis, you're doing great. But keep your knees together. Your knees always want to move apart, so make sure they stay together. And now, taking your hips with you, slowly go deeper. Many people can't go as far as Mira. Don't let this confuse you. Even if you're higher up than Mira, you do the exercise at your angle. Let's assume this is the best Mira can do. We stay like this and make sure that our pelvis moves along with us. And then you'll feel a stretch going up along your groin. Here. Very important. There's one muscle attached that is stretched only when your pelvis goes down with you. Because if your pelvis stays up there and you only go down with your spine above the pelvis, the entire exercise is moot. And now, everything is well stretched, and now you stretch your legs, in particular your right knee. You want to push your feet to the ground with a lot of force, but keeping this position. Push hard, harder against the floor. Relax. Relax. Don't forget to take your pelvis with you. And then you'll feel the strain along your groin. And now, you're pulling exactly the muscle that we have pre-stretched a minute ago with our osteo-pressure technique. This muscle is now well elongated and we can focus on it. These two exercises in combination are very effective. Breathe a little. A bit more stretching. Make sure your hips move down with you. And now you sit up slowly. And that's it. And if you know someone who suffers from knee pain, then send them our video. Use your WhatsApp friends list. Share it because this is a brilliant exercise to reduce your knee pain quickly.